every year. Okay. So guys, talking about the Gordon syndrome, right? So Gordon syndrome, it shows a whole lot of it shows a whole lot of symptoms of what? Arthrogryposis. So you could also say it is also known as what? Arthrogryposis. Yes. So this Gordon syndrome, we say that it's a rare genetic disorder. So it affects your joint movement. So it's classified under distal arthrogryposis. That's why I say you could also say it is arthrogryposis. Understand? So it is characterized by what? Are you hearing the disorder characteristics now? So there's stiffness and impaired mobility in some certain joints, okay, particularly in your arms and legs. So this leads to what? Conditions known as what? You are having permanent flexed fingers. Okay, so this is the permanent flexed fingers. Your hand fingers are flexed. That's what is known as what? Camptodactyly. Okay, you're having clubfoot. Okay, twisted, a lot of things. There's cleft palate. Your lips can be what? Divided. So despite these physical challenges, intelligence is typically unaffected. So causes and genetics is usually caused by what? Mutations in the what? PIZO2 gene, which plays a role in what? Mechanosensation and joint movement. It follows an autosomal dominant inheritance pattern, meaning a single mutated copy of the gene can cause the disorder. Okay. So symptoms is what? Permanent flexed fingers, that's Camptodactyly, clubfoot, cleft palate, joint stiffness and limited mobility. There's some spinal abnormalities like what? Kyphoscoliosis, lordosis. So diagnosis just based on clinical examination and genetic testing. Treatment is you are trying to manage these symptoms, right? So physical therapy to improve mobility, orthopedic intervention for all those joint abnormalities that are usually coming up, right? The surgical correction for the cleft palate or some severe joint deformities, right? So somehow there's a way their kidneys is also affected. That's why I brought the picture of the nephron here. Okay, so that does it for Gordon syndrome.